So I'd like to ask Ignatius Anukwu, who I've also spoken to recently, about his experience in Nigeria. He's also had a deep experience in building the industry in Nigeria. And I'd like you perhaps to share with us your experience, Ignatius, and how you have contributed and how what your observations have been about the building of the Nigerian pharmaceutical sector. And if you have any insights to share about what the CFTA could do, we'd welcome you to share that with us now. Thank you, Ignatius.
Thank you very much, Faisal and Mabel. I'm happy to be here. So it's great listening to Okube and Ngozwana and Mazio Babu and others who have spoken earlier on. And, you know, their insights and perspectives have really been great in helping to also share mine. So for us in Nigeria, the pharma industry has not moved on as we would have loved it to be. So as Mazi had shared what happened in the 70s and 80s. So 90s to the present moment, we still have very low contribution of government to the pharma sector in terms of funding, because health spending in Nigeria is still low, sometimes most of the time below 5% of budget spending. So you find out that most of the players in the industry are private sector players, and these private sector players are doing something around 95 to 98% of what happens in the industry. And so we'll find out that quite some challenges, you know, face them. As he has mentioned, we have this infrastructural decay situation in Nigeria, where power, water, transportation, and all of that can be a challenge. For example, the average manufacturer in Nigeria runs a diesel generator, you know, and if you have to do that for 8 to 18 hours for manufacturing, that raises the cost of kilowatt per hour. So at the end of the day, many of the situation here raise the cost of inputs to manufacturing largely. We also have this issue of multiple taxation. We also know that Nigeria ranks very low in the ease of doing business across the nations. So these are things that the manufacturers here have to contend with. Also, from what Ngozwana said, funding is a critical issue. Today in Nigeria, as Mazi has mentioned, the Central Bank of Nigeria has, you know, made an intervention of about 100 billion naira to help manufacturers ramp up their productive capacity because of the COVID challenge, which is very much welcome development, and we are happy to have that. It had never happened before, so we are really happy to have that. But then the pharma industry in Nigeria should be having a grant that is floated just for the industry so that we will be able to do something much more meaningful. And such a fund should be having about a 5% interest rate with about 2 years moratorium, just like Ngozwana has said, and his experience in manufacturing, to set up a plant and begin to have products out of that plant. It will take not less than 2 to 3 years. So we need quite some reasonable time as moratorium. And then the duration, because of the return on investment, can also be, you know, tricky. It is not so fast in coming. So such a fund could be very helpful, and we don't have that as of present. Also, has been mentioned, no APIs or excipient manufacturing takes place in Nigeria. We all import what we use to manufacture, and there is low capacity in terms of technical manpower. Okay, so we have to deal with that, because some of the times the technical manpower we need are imported either from Asia or Europe, and all of these have a way of impacting the cost of manufacturing. So other consequences are that our pricing is not competitive because of the situation. And most of the time, some of the people that have set up their plants are having experience of low capacity utilization. So what are the things that we're looking forward at in the immediate? It's great to see Okube talk to us today. He has been a very strong motivation for us here for what has happened at the Kilonto Park in Ethiopia. And so we are, moving on with the same experience, and we are geared towards setting up our own first pharmaceutical park in Nigeria, which we have called the Pharma City. We've concluded the business case, and we're already engaging with state governments to see if we can get land allocation in order to set this up. Of course, the concept is the same, that when we have co-location of manufacturers in a place, the issue of infrastructure, for example, in Nigeria, where we are not sure of when this can be handled, once we have an estate where you have manufacturers all together, there will be some shared services and things like power, water, and effluent plants. Stuff like that can help reduce the cost of setting up. So we hope that that will help manufacturers to mobilize to site. And the outcome of that will be that they will have better margins and they will be more competitive because the cost to production would have dropped significantly. And in doing this, we hope to mobilize to that same park API manufacturers and the excipient manufacturers. And we believe that this process will have us speak to the diaspora Nigerians, especially those who are pharmacists, so that they can support in terms of manpower development, workforce development, and technical expertise. We also hope that in that park, we'll be able to do more of indigenous research, and collaborating with those in academia and research, we should be able to translate some of those products of research to commercialization. And of course, when this is done, we would expect that we can export some of these products and earn GDP for the country. So for this to work, we will also look towards having such a park in a free trade zone. In terms of AfCFTA, how it will facilitate building of pharmaceutical and healthcare regionally, the value chain, I can tell you that what we are doing today is credit to AfCFTA, because this conversation perhaps wouldn't have been happening if the AfCFTA had not been in place. And so I'm happy to be here discussing with other people across the region of Africa. And I'm very well pleased to note that somebody like Seth Akweche, who will be speaking later on, has quite a lot of capacity that I can tap into. I've listened to Okube, and perhaps I can also relate with him. And so this is what FTA is bringing about. So in the whole gamut of the value chain from manufacturing to retail, we can see that there are huge, really humongous opportunities that is there for all the African players. Now, for us in Nigeria, usually we like to say that we have the largest population in Africa. We're talking about 200 million people. But today, the AfCFTA opens us up to about 1.3 billion population. This is huge. So what it now means that for a manufacturer in Nigeria, elsewhere in Africa, your market size is opened up, greatly. So it's a huge opportunity. So it will help those who are investing in manufacturing to even dig in deeper, knowing that the investment will pay off later on. AfCFTA will also help us to leverage on technical expertise. Okay, when we look inside Africa, I'm sure that when we begin to leverage on what each region can help the other do, it's a welcome development. So this will benefit the value chain, as well as the sourcing of APIs and excipients intra-continent, which is not happening now. I'm sure that by the time the regulatory harmonization has been done and all the legal framework is finalized, it may be cheaper at the end of the day for us to source APIs from within among ourselves in Africa. And then, just as one of the earlier speakers mentioned, we have to also look at the whole gamut of distribution of medicines, from manufacturing through importation, through distribution, wholesaling, and even retail. So what it now means is that players in this value chain will begin to set up, the distribution network to be sure that wherever production is happening in Africa, we should be able to take it on and move the medicines closer to those who need it. So these huge opportunities exist, and I'm looking forward really to the 2021 implementation of this AfCFTA, and we wish that our heads of government will do what is necessary. But what seems to touch me at this point is, if we are talking about 2021, which is just about 3 months to come, stuff like discussion and conversation among key players in the continent should be happening now, so that by the time it's time to play, we all already know where to go. So I really hope that this conversation we're having today will move us forward towards that. Thank you very much for this opportunity to speak at this webinar.
Ignatius Anukwu, you want to give us a last word on how you think we can go forward?
Yeah, thank you very much for getting back to me again. It's been quite interesting and very valuable for me to be at this webinar. I'll thank Faisal, Mabel, and Penny for all that you guys have done in setting this up. And really, this is where I want to speak to. Conversations and platforms where those who are in private sector can also leverage on this whole idea of AfCFTA. The governments have their own roles to play, and usually sometimes the will of government is slower. But when you throw this to private sector investors, they seem to move faster. So like Daniela has talked about regional hubs and all of that, by the time we leverage on what each of the players in the different countries or regions are able to do, then you can see that the conversation will move faster. So as has been said, it's a journey. It's not a destination yet. It's a journey that will take us quite a long time. So the more we converse among ourselves, the more we have platforms where we exchange and engage one another. I think that will help us to move faster, and I'm very happy to be part of that. Thank you very much.